Now, welcome back. NHS dentists are facing backlash for selling Botox and lip fillers.
Yes, practices have been found right across the country flogging aesthetic treatments, including one that offered a facial slimming treatment. I could do with that myself, to be fair.
Stop it. Don't be so nasty to yourself. Well, the campaign group Toothless in England, which is advocating for an NHS dentist for everyone, said the situation was unfortunate but inevitable.
Well, let's talk to Dr. Serina Sehgal, who's also known as the Foodie Dentist, and lifestyle journalist Annette Kello. Good to see you both this morning. Serina, what do we make of dentists doing this on the side, as it were?
It's a really interesting question, to be honest. I mean, dentists are taught facial anatomy. We are taught the head and neck in quite a bit of detail during our undergraduate training. But dentists have gone out on their own and they've got specific training, done additional courses for injectables, so fillers and Botox. And actually, it's not just for cosmetic reasons, Botox. It's also for functional reasons. People who have something called TMJ disorders, which are essentially jaw aches and jaw tension. Botox can actually be used to relieve this. So it isn't just for the cosmetics, how we think Botox is useful. It can actually be used to relieve pain. But I don't think banning NHS dentists from injectables, in my opinion, doesn't really solve the NHS crisis, because there are some benefits to it also.
OK, Annette, what do you make of it?
Well, I think one's about skin, one's about teeth. You need to decide whether you're Arthur or Martha. If you are going down the aesthetics route, that's a whole different look. It's, I worry as well when young girls go to the dentist and see, ooh, have your filler here, have your Botox. It's everywhere already on social media. And I feel it's one extra place where it shouldn't be needed. Now, there's 12 million people needing dentistry at the moment who have unmet needs. And I also feel, I've seen it on TikTok even, with doctors advertising, oh, don't bother doing doctors going down that route, just do aesthetics. And I think, where is this all going to end? It sounds a bit bananas. And I associate the dentist with pain.
But Annette, isn't going to a dentist, as Serina says, they've studied facial anatomy, isn't it better for patients to go to a dentist, a professional, rather than these backstreet clinics that we've seen pop up and down the country?
I do agree that doctors and dentists are the best people to do that. But I also think there's a moral compass to it, where I think, nurse, for example, when I was pregnant, I went to have my bloods taken and the nurse said to me, oh, after the baby's come out, do you fancy a bit of Botox? And I was like, pardon? And then he gave me his card. Now I think, where's this upsell going to end? And whilst I do appreciate they know anatomy, and that's great, I do think just have an aesthetics clinic. If you want the big bucks, have the aesthetics clinic. In fact, even train further and be a plastic surgeon. That's where the mega bucks are. But I think dentistry...
Oh, the lines crashed a little bit there. Serina, Annette raises a really valid point, doesn't she? And although Botox may be used by dentists for jaw pain and something which is sort of related to dentistry, the idea that, and we struggle to get a dentist appointment as it is, the idea that actually half the time is going to be taken up with, in effect, beauty treatments, does just frankly seem ridiculous at the moment.
I do understand this point of view, but I think that dentists are trying to promote a more kind of comprehensive care, because I have personally seen the benefit of...
Forgive me, but it isn't comprehensive care, is it? Beauty treatments is not about care. It's a different industry. It's not about... Most people don't need beauty treatments for their well-being, do they?
Oh, sure. And I think beauty and doing Botox for functional reasons are two kind of separate conversations. So I've personally seen the benefit of people getting Botox to relieve their jaw pain, and that can be transformative for some people. But I understand, in terms of the cosmetic side of things, that maybe dentists should differentiate, but also Botox is Botox, it's an injectable, and I think that it should be provided as a sort of comprehensive care to alleviate patients' pain, because it really does help.
Well, I think people would understand it under those circumstances. It's the rest of it, really,
Yeah.
I think. Serina Sehgal, good to see you. Thank you very much indeed. Annette Keller, whose signal dropped out just a moment ago, we were talking to as well. She was a lifestyle journalist. I've got to say, I find it concerning.
Well, especially if you can't get a dentist appointment, which we know people can't. We've seen those 4 a.m. queues, haven't we, in Bristol? People trying to get signed up to an NHS dentist. 4 a.m. people started queuing.
Yeah, I mean, I've given up all hope of an NHS dentist. I go private because I don't know what else do I do?
No.
But then again, even with that, I mean, I need a new crown because I pulled one out last week. Do you remember?
Yeah, did you see the video of that? It was very bad. Instagram.
So I've had it put back on.
Oh, have you? I haven't actually asked you. I feel like a bad friend.
No, you haven't. It's a very bad friend. So I got it back on that day, but it is slightly fractured, so it's got to be replaced. But they can't see me to put a new crown on till end of May.
Well, that's no good, is it?
So, but at least this is back on now, so it's doing most of the job.
But this is the thing about dentistry, is often it's urgent. It's urgent care. It's people with toothache, and if you've had toothache, you know, it's the worst pain. You can't do anything for it unless you see a dentist.
We need more dentists.
We do.
And especially if you're a private dentist, of course, it's a well-paid job. So it was always thought of as a really high, when I was young, if you became a dentist.
Yeah, dentist or an optician.
It's like, wow, they're a dentist. I went to school with someone who became a dentist.
Yeah.
And it was, like, really impressive.
Yeah, respectable job, yes.
Yeah.
Well, let us know what you think about that one. Let us know if you're struggling to get a dentist appointment.
Or a Botox appointment.
Or do you go to your dentist to get Botox? Let us know.
Yeah, if you do.
Yeah.